Now, when you think of steroids, you probably think of the abuse by the professional athlete. Maybe he's trying to break that home run special. Or you might think of the local gym rat that you see down pumping iron every day and he just looks way too big to be real. Well, what you've not really thought of too much is the medical use of steroids and how it saves lives and it helps people overcome certain types of sickness. Hi, my name is Ryan 3, and the use of medical steroids has changed my life personally. Now see, 14 months ago my twins were born premature, 6 weeks premature actually, and their lungs haven't fully been able to develop. So the doctors actually physically injected steroids into my baby's lungs to help them develop outside the womb. Now you may ask yourself, why am I telling you something that's so personal to me? Well, the answer to that is I'm attempting to gain your support in the advancement of medical studies and the medical use of steroids. So maybe somebody else can have a change of life just like I did. Now you may also think, wait, steroids are an illegal drug and should not be used. But in fact, steroids are already all around us. Topical steroids have revolutionized the practice of dermatology since they were introduced in the late 1950s. They're an effective anti-inflammatory used to control eczema and dermatitis, and many other skin conditions. They're also called topical cortisone. Now, you are sure to find the active ingredient of hydrocortisone just by walking down the aisle of your local drugstore. Now, from your drugstore to your doctor, steroids are a daily item that is dispensed from our pharmacies. When the medical benefits of steroids are alarming, anabolic steroids have several legitimate medical uses. For instance, when a man comes down with testicular cancer, he often requires the removal of his testes, and after surgery, these men are prescribed oral steroids to replace the testosterone that their body is no longer able to make. Anabolic steroids are also given after certain kinds of surgery and cancer. When the patient experiences a loss of muscle tissue, anabolic steroids with the proper exercise and diet are used to rebuild that muscle tissue or that muscle mass. Anabolic or adolescent males with a proprietary malfunction are treated with injectable steroids when they reach the appropriate age for puberty. Steroids given for 4 to 6 months in the proper dosage and schedule can cause a sudden growth spurt and develop their sexual characteristics. With the noted advancements in medicine and the cures for illness, steroid use does have a good side. But wait, in order to have a good side, you also have to have a bad side. Well, like all medicine, steroids they are associated with potential side effects if they're used incorrectly. But compared to other more commonly used drugs, the effects just don't stack up. Other inflammatory drugs, including aspirin, ibuprofen, and naproxen, contribute to 7,600 deaths and 76,000 hospitalizations in the United States alone. Now, the Center for Disease Control lists the number for deaths due to anabolic steroids at 3 per year. Yes, you heard me correct, 3. Now, with the numbers like that, there's no comparison. Steroids is a safe use. In conclusion, while you may think that you are not a supporter of steroid use, when in fact you have used steroids or benefited from the use of steroids somehow in your life. I know I have. Remember my kids that I was talking about. Finally, I have informed you of the medical advancements already being made by steroids. I urge you to look into my research and to see a positive side of the effects of steroids and to support the medical use of steroids.